When the skull is viewed from behind, the dominant structure is the occipital bone, forming the posterior portion of the cranial vault. The occipital surface presents a broad, gently curved expanse that slopes downward and inward toward the foramen magnum, though the opening itself is not visible in this view. At the center of this posterior aspect is the external occipital protuberance, a midline elevation that marks the most prominent posterior point of the skull. From this prominence, a faint ridge known as the external occipital crest descends inferiorly toward the region of the foramen magnum. Although the crest becomes more pronounced toward its lower extent, only its upper segment is typically seen from the strict posterior view. Extending laterally from the external occipital protuberance on both sides are the superior neutral lines. These lines curve outward in a smooth arc. Inferior to them, though often less distinct from this angle, lie the inferior neutral lines, which run in a similar but shorter and lower trajectory. Framing the occipital bone superiorly are the paired parietal bones, which are visible in the upper portion of the norma occipitalis. Their articulation with the occipital bone is defined by the lambdoid suture that forms an inverted V-shaped outline across the back of the skull. The junction of the lambdoid and sagittal sutures, the lambda, can be appreciated along with a prominent emissary vein. Inferiorly and laterally, the occipital bone meets the temporal bones at the occipitomastoid sutures, situated just medial to the mastoid regions. Portions of the mastoid processes themselves may be seen projecting downward and laterally from beneath the posterior edge of the temporal bones. The overall outline of the norma occipitalis forms a smooth, broad curve superiorly, narrowing slightly as it descends.